Hello. Welcome.
Hello. How are you?
I'm good. Welcome, everybody. Theresa, Meyer from Independence Village Senior Living. We have so much in common. I know with our vision, helping seniors and how they live. And as people know, I have an affinity over here. We focus on keeping seniors living in their home independently as long as they can. And Independence Village, Theresa Meyer is the business development manager there, and she offers a senior living experience for those seniors that are not living in their home. Sometimes these people choose not to live at home, or sometimes they contact Theresa. And so whatever home it is, it's whether home or at Theresa and with Independence Village. So welcome.
Thank you. Thank you very much. Glad to be here. Yes, we do. We're not just work with a lot of the same people in the same community, but we're not far down the street from each other.
We're neighbors.
Yeah, we are.
And also friends.
Yes, for sure. Everybody's got to be friends. We all got to work together.
Yup. Yeah. Yup. You know, you guys always had a great reputation in the community, and it's always a pleasure sending our clients to you guys. And we know we could trust you. So, first question we wanted to ask you is that can you explain what Independence Village in White Lake offers the residents?
Sure. So, Independence Village, White Lake, we've got almost 150 apartment units. And it's definitely, oh, sorry, there goes my email buzzing. It's a comfortable apartment style living. We have everything from a studio up to a you can face the pond. You can still, we've got carports. You can use our shuttle service. You can drive your car. But we also have enhanced living features. So you can be you can really put what I can't think of the word, specialize, package what you need. You may need, you just want to be in the community and have that, the meals and the housekeeping and, having other seniors around you and whatnot. Or, you package what kind of services that you may need, which we would, which is in our enhanced living.
Mm-hmm. Yeah. And, sometimes I know that with home, some family members feel like that when they get home care services, they think they can do the same, but when their parents are alone, who's getting their meals, who's getting their medications, is it all the unknown factors? But I know when you have to make the decision and possibly be in a facility, all of that is there and it's kind of packaged up in one deal, right? Kind of like what you're saying. Right. But it's this factor of I think a lot of our family members face, you definitely, kind of understand that, is that do they choose home care or are they going to a facility? And that's kind of like what we're talking about today when is home not the right choice, and when is it choose to have assisted living, or when is possibly you want to bring mom and dad home for their last months of their life and and move them out of a facility too, possibly.
Well, go ahead.
Oh, I'm sorry, go ahead.
I was gonna say, I think it really, every person's situation is different. You may be able to stay home with home care, and you've got that family that lives close that can help or can check in on you or do your grocery shopping, make sure that your nutrition. Obviously, it's different. Can you get around the house? Do you want to do maintenance to your home anymore? That type of thing. So I think it's just really an individual experience. We've got families that, a lot of kids don't live close to their parents anymore. So we've got families that are moving their parents, near them and want to still give them the independence of having their own apartment. But with the, 24-hour staffing and whatnot. And I need to make sure that I say this because we're very particular at Independence Village. We are a community. We're not a facility. It is your home. So we really like to make sure that that's the way we present ourselves.
So how does someone know about moving into a facility like Independence Village is a step that they need to investigate? Like when do they know? You feel like when they're coming to you at that point in time, when they're on the fence?
So I feel like there's many different things. sometimes, again, it's just a matter of you've got an independent senior who's not wanting to rake the leaves anymore, which we're all dealing with right now. Have the home maintenance, or um, not worry about cooking if they don't want to. They've got their kitchen apartment, or their apartment has a full size kitchen, so they can still do their cooking. It's still just like home, but maybe they don't want to. Maybe they want the camaraderie of going and eating a meal with somebody, or they don't feel like cooking, or that type of thing. So with independent living, you get 2 meals included a day. If you go over to enhanced, which you do not have to move, if you decide you need services, you don't. It's not like you have to go from independent living to enhanced. People can stay right where they're at. But I just think that we've got families. It's just very individual. What is the ability for a family to help in the home with home care? Do they want some help? And the other unique thing is couples. You may have a couple that wants to not have the maintenance of a home. It wants to be able to make sure they're getting nutritious meals and cooking. Make that choice. Maybe you have one spouse that's doing more of the care for another spouse. So one's very independent and one needs extra help. We're a really good option for that, because you're still living in a very home-like, cozy apartment style living, and maybe one spouse gets more services than the other. It's an extra added help, and security. So I think that's a unique thing with us, as well as with our enhanced services. It's not that one size fits all package, and you're going to into that assisted, where everything's included, and partners and spouses can stay together and live like they were at home.
I sometimes meet with family members, and they ask me, my mom I'm going on vacation for a week and I need short time care. Do you know where I could place my mom? And I know that it would be sometimes difficult and harder to have a caregiver there for just a week, but sometimes family members feel comfortable having them come in for go into a facility short term. I know that that's what you guys do. Can you tell us a little bit more about how I think we call in our industry respite care, a little bit of break. The family members need a break. They're going on vacation, or they just don't want to provide care, but they want to put mom and dad into a facility, and so I know I deal with a lot of family members. I know I refer you guys in these type of scenarios too. Can you explain what the short-term care means?
Sure. So with us, we are usually more of a long-term care apartment style lease. Then you add your services, of course, again, including, you've got a whole, it's like in a hotel, you get your linens and your meals and whatnot. Well, when COVID hit, we did realize too that there was a need for families more with a respite care. So we do have a couple apartments, depending on availability, that we keep that are furnished, and we are offering some respite care. And that's something that's probably newer, that we've made sure we've set aside, because we're really realizing families right now, even if they think senior living is what they need, or their parent needs, maybe it's just, coming from the hospital, and some people aren't going to short-term rehab anymore, or they are getting services in their home. So we are offering respite right now. Again, traditionally, it's an apartment lease where, you're looking for, like a year commitment, but it doesn't have to be. But I'm glad you asked, because most people don't associate us with having respites, but we are offering them right now. Usually a 30-day respite, and if they need care, again, we have our preferred third party, Loris, that's in there. Or if you have somebody that you have home care with, it's resident's choice. You can also still care for them, and they could come stay with us. So we do offer respite right now.
Yep, it's important for everybody to know all the options available, because they're always going to be on the fence with home care and going to a facility all the time, especially with the shutdown that possibly could happen that we're hearing right now. Is that it's going to be more difficult to research to find the place that you want to go to. So it's more important to get the information now, to just in case you have to make a decision. I've been to your apartments. I love them. I would live. I would say.
Sometimes I want to say, can I move in and get our culinary? We really we've got executive chefs, and they are top notch. So we do brag about our food. We brag about our executive director. That's one thing that we do a little bit different than other communities do. Our executive directors, instead of looking over the whole finances and all of that, they are 100% resident focused. So it's like a concierge. So whatever you need.
You can play putt-putt at your place,
Yeah, oh,
right?
you can play putt-putt.
Yeah.
Yes, you have a putting green. You sure do. Yeah. And even
I played
right
on
now, what'd you say?
I played on it once before.
Oh, did you? I heard about the green. I'm talking over you. I'm so sorry. You played on it. Was it when they opened it up? I didn't work there yet, but I heard there was a grand opening when they opened it up. So.
Yeah, well, I mean, if someone was around there and they asked me to play.
Yeah, yeah. So we definitely, we have a putters club. So, and even right now with COVID, we are having some activities. We're taking it week by week, day by day, depending on, what's going on out there as far as social distancing. But our residents are having interaction. Obviously, social distancing, encouraging mask wearing. Families, can visit. We're making appointments, and again, it's day by day. We're watching it. We screen people when they come in. Some family is their essential care giver. They're living with us, but like I said, you can take the services that you want and that you don't want if you've got a family member. So we're making sure that we're definitely with COVID monitoring, staying safe, and we've been healthy the whole time. We've never stopped taking move-ins since the beginning of this whole crisis.
So a common question I get is that what do we do with my mom and dad's furniture if we move them in? You guys do you take the actual individual's furniture in with you guys, or do you guys offer furniture?
So no, definitely. It's like it's sign in an apartment lease and you come on in and you can move. That's one of the big things when somebody's coming in to look at us. We try to help them visualize because they're coming from a home and they're probably paring down. And they think that they're not going to be able to bring their most important pieces. So we always try to work with people. But no, you bring your own furniture. If you need a furnished apartment, we can help furnish it, or we've got connections and services that would furnish it for it. But our idea is coming from home and bringing it and making it your home. So definitely, our residents bring in their own furniture.
Yeah, I know this. So like I've had family members where they would be worried about their mom has Alzheimer's and dementia. And we know, as you know, both, but the public should know too about dementia, is that changing the environment is the hardest part of going through this disease process. And changing the furniture and moving into a facility and bringing their own and having them recognize that is such a huge factor. I highly recommend most family members now is to let you know is that if your mom has dementia or in the beginning stages of it, changing up things is probably the worst thing you could ever do. So bringing in those pictures and bringing in those furniture and all the little things that remind them of their past is to bring for them is probably the best transition you could ever do for your family members. So a question I have for you is like the level of care within your facility. Do people change and move back in and out again? Because I know that I feel like I know that answer, but I want the public to understand is it possible for them to come and go living independently in a facility?
Definitely. Again, we're everything independent all the way, again, through what we call enhanced, which is, similar to assisted living, but you get to, create your own package, basically. It's not a one size fits all, but we have had couples that have moved in actually, and maybe, one of them needed more help. And then they lose their spouse. We've had them, move back, whether they move back home or they move with their kids and even move back in again. So again, it's a true apartment lease. So, we've had that situation. And again, because we say we have an independent and enhanced living, it doesn't mean that you've got to move to a different side of the building. You can get services wherever you are. It's just if you come in with enhanced, you're already over where our nurse's desk is and whatnot. We do have a wellness coordinator and a registered nurse on staff. And our wellness team is always looking out after everyone, whether you are in our enhanced living or you're independent. We are constantly watching out for people, communicating with families and making sure, because there is a difference. You even mentioned dementia and somebody moving in. A lot of times they end up thriving better because they do have a routine, or maybe they were at home and they were alone. So a lot of times we find that people that maybe weren't doing so great at home, once they get with us and they get that routine and they feel like they've got that option of surrounding themselves with people or staying in their own, cozy apartment, We find that
Yeah.
a lot of times they thrive. They end up thriving, doing better. They're eating better. Maybe they're not eating their 2 or 3 meals a day, or they're, missing the medications here and there. So, again, it's very tailored to whatever level you need.
I know when we get our clients, a lot of the times they're leaving the hospital, leaving a facility, a rehab center, and they might need nursing care or therapy. Typically for someone recovering from an illness or a surgery, or could be involved in an auto accident and has some type of chronic illness. But what if one of your residents has a type of a situation and needs to go into the hospital? How do you guys handle that?
So we definitely, again, have a wellness team that watches out for everybody. And, we have what we call navigators. And our navigators will follow our residents at the hospital or whatever skilled nursing facility that they may be in. So we make sure that they're transitioned back to home with us, that they're set, that they've got what they need. Do they need durable medical equipment? Are they going to need some therapy, some skilled help, whatnot? So our navigators do follow our residents, and we every morning I get a report. I know who's in the hospital. I know who's at different skills. This morning I made the rounds at some of the skills. We had a couple of our residents there. We want to make sure they know. I'm not navigating. I'm just doing the community touch, but I drop off bedside boxes to them. I was doing it this morning. I was at over at Metal Lodge in Milford, but we make sure that we are helping the family and helping the resident to make the smoothest transition back, and hopefully get them the services that they need, so they're not ending up back in the hospital or in the rehab or whatnot.
Tell us about that. You drop off food to where? To the residents' rooms?
So, no, meaning like I do have some residents that are in some different skills right now. They were in the hospital and they went to a short-term skill. Whether, we've got some local ones around us. We've got, Westlake Health Campus and, Metal Lodge in Milford and some of the other ones. So our navigators will follow our residents. So whether they're in the hospital or they're short-term rehabbing, we make sure that we're following them. I will go and drop off a little, bedside box. It's got a crossword maybe, or a pen, or lotion, or water, or just something to let them know that we're thinking about them. And if they want food, if it's allowed, depending on what's going on, right? So
I mean, can you go in the facilities now with COVID-19 right now? You just more, it's like you're going in and you're going out.
I'm going in and I'm going out. I usually go in just to the front desk or to the front door and drop things off. Everybody's a little different, but no, I'm not allowed to go into those skilled nursings. But I do a lot of Zoom calls. I do a lot of phone calls and emails with the social workers and whatnot there, even to help get people the information about us. So it's a two-way street. We've got residents in the short-term facilities, and we have the short-term facilities calling us to try to help navigate people, to our community.
So let's talk about the coverage of insurance. Now, a lot of family members ask about us. It's easy for home care because insurance does cover skilled home health care, especially if you have Medicare. Medicare covers your care 100% if you need a nurse or in-home rehab or a home health aide to come in. But private pay, our private pay division is, it's only covered unless you have long-term care insurance, and if you do qualify for veterans or Medicaid as well too, other than private pay. But for Independence Village, what type of insurance do you guys accept for someone to come in?
So we're the same as you would say with the non-skilled home care. Again, our navigators will help them, if they need that skill that is covered by Medicare when they come in, back home with the therapy and stuff. So we help coordinate all that. We do have some people that will use their long-term care insurance, like you said, and we'll help them with that if they're, getting, assistance with their ADLs. Again, every policy is different. Everything they cover is different, but we definitely give assistance to help them navigate through that long-term care, or recognize the fact that they may have that aid in attendance. A lot of people don't know where to start, don't realize that they have it. So we definitely try to help in that area. Otherwise, yes, it's private pay. Again, it's an apartment lease, so you're paying all of that privately. But if anybody has any resources that they can use, whether it's Medicare with some therapy or long-term care insurance. We definitely help them out and make sure that they're getting what they need.
I've seen times where where our nurses and therapists and caregivers would come in individually in each other's homes. So it's okay to bring in your own home health care company when coming in and staying at your facility.
Yep, it is. I got to break you. You got to call us a community, Chris, not a facility. We're a community.
Community.
Hey, we are a senior connections company because we just really want to focus on people. Well, in the facility, people get, they think of the hospital.
They're locked up, you know what I mean? But I know when I walk into the place, there's music playing, and it's just it's a great feeling.
Yeah. So what was the question that you asked me? I totally
with COVID-19 going on, and all the changes that we're all going through right now, and it's like, it's been a big roller coaster ride for all of us, in the care aspects. There's been some celebrations to celebrate, a lot of great stories to share of helping a lot of people, but at the same time, it's been a lot, some downtimes where it's hard to help others when you really want to. So, what precautions and changes have you had to make over there in your community?
So immediately when COVID hit, we've got a very strong, exercised, well-organized flu protocol when we hit flu season. So we were already following that protocol. So we were, I feel like we were prepared that way. Again, when you come in, if you are an essential caregiver, we take your temperature, we screen, that type of thing. If families are visiting, they're making appointments. The weather's getting a little, not as warm as it was. So we were having, maybe courtyard visits or that type of thing. So we're working on, do they come into the library that's right in the front? So we're making sure that we're managing it so we're not bringing it in. But we're also making sure that we are finding ways for our residents to be able to visit with their family. And the other thing is, we have very independent residents. They're allowed to come and go. If they go to a doctor's appointment in the beginning of COVID and when COVID was rampant, if you did have to go out, you came back in, we might have you on a temporary separation. We haven't had to do that in a while. Again, it depends. Are you coming from a skilled, they're having COVID tests before they get back to us. So, but we're definitely not completely on lockdown. They're going out and whatnot, then we're screening when they come back and just making sure that we're following those precautions. But again, families are not coming in and out every day. They call, they make an appointment, make arrangements, but people are able to get contact with their family. Because I think that's the worst thing right now. People are so worried about not being able to see their loved ones. And one of the biggest reasons I think seniors should move into our community or do move into our community is because it's just the loneliness. It's I'm what I call a sandwich generation kid. I've got two elderly parents. A few years ago, my mom was living with me when she was recovering from cancer, and I had teenagers at home. So I'm like, the person that we market to because I'm that adult daughter that's, helping, old aging parents. So definitely important thing to make sure that people are in contact with their family.
I this morning went to Farmington Hills, met with a niece of a client, and she lives in Illinois. And so the client didn't have any other family members that lived here in Michigan. So she was suffering from Parkinson's disease. And she was on the fence of deciding on what to do because she has to go back to Illinois and go to work. And her aunt is rapidly declining. And the community members, it's funny, when we were there, one of the neighbors came and stopped by to check on her to make sure she was okay because she knows the niece was in town. But now there's a gap in between where the niece eventually have to go. And then what's going to happen with her when she's alone? And she's a big fall risk. And these are the type of decisions where I had to discuss with, give them the choices is that, you could have home care and, have someone here around the clock so you could have peace of mind. Someone takes care of her meals and her medications and make sure she does need her hygiene. Someone's there to make sure she doesn't fall. Or you have to go into, live into a type of community and possibly, or I hate something now. Family members like to hear this, but they have to sell their home, and use that, and use those funds for the remaining time, and then use it towards living it into a facility. So the family members had a lot of decisions to make, and so the niece obviously has a very short gap in between of deciding home care or moving into a community. Obviously, home health care, there's situations like what we offer are different from moving into a residential situation. So some people will use us, and some people will contact you. And I hope the viewers and people that are watching right now, that if you are going through this type of situation, if you could comment below, we're gonna just give you, maybe like about 30 seconds to a minute to comment while you and I will chat, and we can answer anybody who's watching this any questions you have regarding independent community living, or any situation you got going on with your family members or anybody that we could answer. You have two specialists on the line right now here. We could talk about home care. We could talk about moving to a facility. So, Theresa, what's your typical day look like for you?
For me, well, there's no typical day right now because it all, since COVID. But on a normal day, with business development, I'm usually out in the community. I'm visiting with everybody, like we said, whether I'm stopping by, short-term care facilities just to brighten our residents' day and bring them something, to talking and educating financial planners, elder law attorneys, physicians, partners like you on what we can offer, and the specifics, because every place is a little different, in the community. And like we said, we're all friends, and I always say we all play nice in the sandbox, because what I have at Independence Village may not be what everybody needs. And there's other people out there, whether it's home care, whether it's another, senior community. So we definitely try to, when I'm out in the community, that's my message, is my biggest thing is let's make sure we're taking care of our seniors. Like you said, giving them options like that niece, here's different options, here's the pros and cons, and just trying to counsel families, versus just saying, oh, you got to move in, you got to do this, or I think that everybody needs help, because it's so much education, whether it's Medicare or Medicaid, or what do they do and who pays and that type of thing. So my day is typically running around and seeing people. And in a normal time, I would be doing education programs, and partnering with, people like you. I miss that. We're doing some drive-by events, so at least people can see our faces and come by. Actually, we've got drive-by for pie coming up if anybody's interested in professionals and families. So at least you see where we're at. You see
what kind of pie?
You can pick a pumpkin or you can pick an apple pie. So.
Ooh, okay.
And it's hot. It's the week of Thanksgiving. So, and again, our culinary is very, very good. So some people just move it for the food.
I have plenty of times have you guys had food. Sometimes you guys have pastries up in the front to purchase.
Yes.
Yep. Really, really good. I bought those several times. You got this like really nice pastry sitting. It looks all fresh. Obviously, you guys cooked it from there. I buy that, and actually, I buy that and use that and give it to my next client. I go see.
Oh, that's perfect. I'm glad to hear that. Well, since you're probably not coming in and out of there, if you want anything. Yesterday, I discovered something new for myself and bought one for myself, because obviously our residents go up. We've got a little store in the front. And by the way, the person who's making the pastries and the breads and all that, her name is Margot. And she's not the kind of person that, Margot, I mean, we've got our executive chef, Dan, but I've got to give the pastries and the baked goods. Margot's fantastic. But I just grabbed something new that I didn't know about, cheesy bread. So I took a loaf of cheesy bread yesterday, and I was taking it out to a couple families, and then I'm like, I'm going to pay for some myself. Yeah. So good stuff.
It's going to a good cause.
I know, right? COVID wave. Let's just add more of it. Yeah.
Exactly. It's a win-win. All right. You have to cook dinner. I got some cheesy bread too.
There you go. I know. Yep.
That's great. I don't see any questions right now, but if any family members do have any questions, please leave them in the comments below of our social media platforms, and anything that regarding that we'll make sure that we connect you to Theresa if you have any questions regarding her services she provides. Thank you for your time. God bless you and everything you do, and for our community, and you know how important it is. And we'll be chatting soon again.
I appreciate you having me on, Chris. Thank you very much.
Yes, you're welcome. We'll talk to you soon.
Bye-bye. Bye-bye.
Yep, bye-bye.